think also Kimberly discovered when she was working with you that there was some tension in your forearm, even all the way up to your shoulder. So that was really beneficial. And I think as a hand therapist, we often don't think about going up and finding that energy block in that forearm up to that shoulder. And that would be another place to go in person where we could, work on the physical body, work on releasing the tension that's in your forearm muscles. And I think for hand therapists, it's a really useful tip that if you can assess that, even doing a vector assessment, looking at how is your patient using their hand? What are they doing? So, for example, I know because this is my mom, because it's been winter in South Africa, the dogs have been sleeping in the kitchen. So she's been lifting and carrying really heavy dog beds in and out of the kitchen. And just that action, the way that you're doing it with your hands is going to create the strain in the forearm, create the blockages, cause a triggering. So as hand therapists, we tend to go straight to the A1 pulley and work there and, apply our kinesio tape and change the alignment and make splints. But we're neglecting the whole person, what they're doing in their life and where those other energy blocks can be. And then to take it to a much deeper level, knowing you are in that fight or flight. I think as a hand therapist, if we take a step back and go, all right, well, if we go to that organ and help that person relax, and that was the other thing with the meridian, is that it is on the ring finger, which reason why you went into such a deep sleep is because working on that meridian induces deep relaxation, which I think is a sign that we do need to go to your adrenals and that we do need to, manage your stress. And perhaps part of your hand therapy program would be doing more of Kimberly's biofield tuning on her Spotify, lying in bed, listening to that, just taking taking a break, which you are now, at least in Spain, you're taking a break. So I think it's just such a big lesson for us as hand therapists to look beyond the A1 pulley.